Need help paying for healthcare costs? Medicare Savings Programs can be the answer to your medical needs. Need help paying for healthcare costs? If you or someone you know is having trouble paying for healthcare costs in these uncertain times, there may be ways for you to save money on Medicare premiums and other costs. You may be able to get help from your state to pay some of your Medicare costs, including your monthly premiums. In some cases, Medicare savings programs may also help pay your deductibles, coinsurance, and copayments if you meet certain conditions. There are four kinds of savings programs, or MSPs, each tailored to a different set of circumstances. Four kinds of Medicare savings programs. You can get help from your state paying for Medicare premiums. In some cases, Medicare savings programs also pay Medicare Part A hospital insurance and Medicare Part B medical insurance deductibles, coinsurance, and copayments if you meet certain conditions. These conditions are listed next under how to apply for Medicare programs. Now, drug plan costs for people with extra help. Those below federal poverty level save over 95% on average. People with lowest income and resources pay no premiums or deductibles, have small or no copayments. These with slightly higher income and resources have reduced deductible and pay a little more out of pocket. That's why you should always apply and let them make the decision if you qualify or not. Four kinds of savings programs. Select the program named below for details about each. Medicare Savings Program. If you have income from working, you may still qualify for these four programs even if your income is higher than the income limits listed for each program. Go to Medicare.gov for latest income limits for these programs. They change every year, so don't be afraid to qualify. Qualified Medical Benefit Program, Specialized Low-Income Medicare Beneficiary Program, Qualified Individual Program, Qualified Disabled and Working Individuals Program. If you qualify for these programs, you automatically qualify to get extra help paying for Medicare prescription drug coverage. Let me repeat that. If you qualify for these programs, you may get help from the state with a program called Extra Help paying for Medicare prescription drug coverage. Note, these amounts may increase each year. If your income resources are slightly higher, you should still apply. What items are included in the Medicare Savings Program resource limits, meaning how much money can you have assets? Now, countable resources include money in a checking or savings account, stocks and bonds. Of course, that includes your 401k and IRAs, but countable resources don't include your home. You can have a $400,000 home, doesn't count. One car, a burial plot up to $1,500 for burial expenses if you have put that money aside, furniture and other household personal items. Stop the video and review the limits of income and assets so see which one qualifies for you. How to apply for Medicare Savings Program? If you answer yes to these three questions, call your state Medicare program to see if you qualify for a Medicare Savings Program in your state. 1. Do you have or are you eligible for Part A? 2. Is your income for 2020 at or below the income limits listed on any of the programs above? 3. Do you have limited resources below the limits above? It's important to call or fill out an application if you think you should qualify for savings, even if your income or resources are higher than the amounts listed, because every year things change. Complete the application for extra help with Medicare prescription drug coverage plans costs. That's a form SSA 1020. Apply online at socialsecurity.gov. Call Social Security to apply over the phone or request an application. Apply at your local Social Security office. Social Security will review your application and send you a letter to let you know if you qualify. Now, please take the little trouble, do the application, see if your income is low enough to qualify for these programs. Again, please share, please like, and subscribe to our channel. And don't forget that we're here for you. We handle all forms of Medicare for you and your family. And if you know someone turning 65, please have them contact us. See you in the next video. Bye-bye.